We're going to begin today with Associate Minister Jason Lewan, who will bring remarks, followed by Steve Matthews, CEO of Aware 360, Naomi Nanya, Paramedic and Public Education Officer with Calgary EMS, Andrea Robertson, President and CEO of STARS Ambulance, and Chris Guerin, a person in recovery. Once they finish, we will then take questions from the media. Thank you.
Good morning, everybody. Welcome to join me this morning. Thank you for tuning in. Also, thank you to quite a few partners with me today. Stephen Matthew, CEO of Aware 360, and Naomi Nanya, Paramedic and Public Education Officer for Calgary Zone EMS. Of course, Andrea Robertson, President and CEO of STARS Ambulance. Welcome. And Chris Guerin, a person in recovery. Thanks again, join us. I am pleased to share some important work Alberta government is doing to support Albertans struggling with addiction. We know this past year has been especially difficult for many people with substance use disorder. COVID-19 has significantly impacted all our lives over this last year. For vulnerable Albertans, this impact was even greater. For those who are facing difficulty accessing to support services that they depend on, the life has been much difficult for them with increased stress and anxiety. Data shows the impact COVID-19 and public health restrictions put in place to keep us safe has had on those struggling with substance use disorder with huge negative impact in their lives. Sadly, 1,128 Albertans lost their lives as a result of an overdose last year. EMS responses, emergency department visits, and hospitalization have all been increased since the pandemic reached Alberta. Each death is a tragedy, and my heart goes out to every family, friend, and other loved ones for experiencing such a loss. Each death highlights just how much more work there is to do to address this addiction in Alberta. The provincial government, along with our dedicated partners, you see quite a few today, we're working diligently to move people out of addiction and into a lifelong recovery, so more Albertans can experience improved health and mental wellness and lead a fulfilling life. Budget 2021 continues our focus on building a recovery-oriented system care that provides services and support ranging from prevention, intervention, treatment, and recovery. We are investing historical $140 million over 4 years for mental health and addiction support in Alberta. Funding is increasing access to services, expanding programs, and establishing new public-funded mental health and addiction treatment spaces. We've also eliminated daily user fees for public-funded treatment addiction services in Alberta, and also introduced a holistic recovery community services in Alberta. Both are historical in our province. Plus, early in the pandemic, our government dedicated more than $53 million additional funding to ensure people can access to addiction and mental health recovery support they need during and after COVID-19. While the ultimate goal is and will continue to be recovery, we recognize that everyone's journey is different. For some, harm reduction initiatives are an integral part of their road to recovery. To be fully and completely clear, this government supports harm reduction initiatives and will continue to do so while connecting people with recovery services. One such harm reduction initiative is opioid agonist therapy, which helps address withdrawal symptoms and cravings. Alberta Health's in-person and virtual opioid dependency clinics continue to accept clients and now offer expanded psychosocial support. In fact, the virtual opioid dependency program currently has no waiting list following our last year's announcement of expanded funding. Another program, the opioid agonist gap coverage, is also helping people to get treatment immediately without worrying about financial barriers. Budget 21 continues operational funding for supervised consumption services and overdose prevention services at 8 sites throughout the province. In Alberta, we also have widespread distribution of naloxone kit. Through this program, more than 321,000 free naloxone kits have been dispensed by Alberta Health Services in the past 5 years. Alberta has actually achieved the highest rate of naloxone distribution in the history of this province. The kits can temporarily reverse the effects of overdose, giving emergency services a chance to respond. Today, I am pleased to share more news, another initiative that we're adding to Alberta's TUPOX, the Digital Overdose Response System, or the DOORS. DOORS is a mobile application that will help protect people using opioids and other substances while alone. The system is one of the first in Canada and built on a reliable technology that already been used to ensure a person's safety while working alone. Albertan using opioids or other substances alone will be able to use DOORS application, which has a timer connected to the alarm system. If the individual does not respond when prompted by the alarm from the application, a dispatcher from the STARS Response Center will attempt to contact the individual. If STARS doesn't receive a response, emergency medical services will be alerted and dispatched to respond as a presumed overdose. This app will also provide information on national provincial addiction recovery support services like virtual opioid dependency program, which has zero wait list, helping ensure people who have information that they need to move toward their journey of recovery. This application has a potential to do so much good for people who are using substance while alone, often at home. Data from our past 4 years shows that majority of people dying as a result of accidental opioid poisoning do so in their own homes. In 2020, 70% of overdose fatalities in Alberta occurred in a private setting. This is tragic and preventable. This application will be rolled out as we speak and getting tested in Calgary over the summer. Calgary has consistently had one of the highest number of overdose-related fatalities in the province, and for the last year has had one of the most suburban deaths when compared to other areas in this province. Today, we're announcing that we're moving into a phase while this application will be engaged publicly with other stakeholders and doing the rollout. This phase will be several months in testing, implementation, and adjusting, and we look forward when we can take this application provincial-wide when it's ready. Our priority is the safety and the security of our Albertans, and we want to make sure the application is functioning optimally before we expand its service provincially. Our ultimate goal is to expand DOORS applications throughout the province at its earliest time possible. At this time, I'd like to take the opportunity to thank the application developer, Alberta-based Aware 360, as well as physicians, EMS, and police service professionals, families, and addiction experts, and people who have lived experiences coming together, work with our government to put this innovative tool into our toolbox. So thank you so much for the great work you've been doing. I look forward to seeing the application implemented and seeing Albertans having access to a tool that respect to their privacy and can also help save their lives. For any Albertan who are struggling to get help, my word is this: don't wait, reach out for help. There are many options available to get help in our full continuum care system we're building. Today's announcement is just another example of such. So most importantly, I want to remind everybody listening to today's announcement that recovery is possible, and we're here to support you getting into your journey of recovery. Thank you so much. Now I'd like to turn the mic to Steve Matthews to share a few words, and followed by other speakers, and then we'll take questions. Thank you.
Thank you, Minister Luan, for the kind words and for the opportunity to help create the digital overdose response system. As a local Alberta technology company, our team at Aware 360 is particularly proud and excited to help bring doors to Albertans and to play a small part in addressing this critical health and social issue within the province. Aware 360's work on this application builds on a 15-year relationship with the province, during which time we've successfully worked together to keep Alberta public sector employees safe and connected as they work and move around the province. Our relationship has been characterized by a mutual desire to make new technology available and effective for public sector workers, and to ensure that they can always be connected, no matter where they are or what their work circumstances entail. The DOORS application builds on these principles from our at-risk worker platform and extends connectivity in time of need to those who are at risk of overdose and using alone. We are grateful to have the opportunity to help vulnerable friends, neighbors, co-workers, daughters and sons, as well as frontline workers in the battle to save lives and reduce the impact of addiction. Outside the public sector, Aware 360 also partners with a number of professional response centres to keep many Alberta employees connected. One of our earliest such partnerships has been with STARS, and together we've developed both technology and best practices to ensure Alberta workers get immediate support and response when they need it. Connecting DOORS participants to STARS is another expansion of an existing innovative Alberta relationship, and one that will ensure our frontline EMS teams get timely information in the fight to save lives. It's been incredible to see these strong partnerships informed by experts in the addiction treatment field, by police, families, frontline workers, and others come together to create this new connection, this new service for Albertans. Together with the province and STARS, we have connected lone and at-risk workers, and we have saved lives. I am confident that the DOORS program also has the ability to save lives and to connect Albertans struggling with addiction to the support and the services they need to help them on their path to recovery. Again, I thank the Alberta government for their continued dedication to building a full continuum of care and for the opportunity to expand our technology and platform in such a meaningful way. Thank you.
EMS is proud to have been an advisor in the development of this new and innovative application. People who use drugs at home are a hard-to-reach segment of the population, and we have the unfortunate many fatal overdoses in private homes in suburban areas. In 2018 to 2020, 60 to 80% of opioid-related fatalities in Calgary and Edmonton occurred in suburban neighborhoods outside the downtown core. More than half of all the opioid-related EMS calls are made outside the downtown core. This application has the opportunity to help us provide a faster response for our patients who may need us. We are very pleased to have been part of a large, multifaceted working group exploring this new technology, which is connect individuals with vital emergency services as well as treatment and recovery services. This application's development and testing is in its very earliest stages, and since our priority is the safety and health of all Albertans, we look forward to moving forward with this pilot project. Thank you.
Good morning. I'm Andrea Robertson. I'm the President and CEO of STARS. Really happy to be here with everybody. Oftentimes, as many of our partners have said this morning, when emergency services respond to a drug-related call, it's too late. The DOOR system will change that. STARS is very, very pleased to partner in this new initiative so that within this emergency partnership, we can play a key role in keeping Albertans alive. STARS, as you know, has been caring for the critically ill and injured since 1985. So this project is another way for us to be there for the next patient who may need us. Although this program's new, monitoring the safety and well-being of individuals is not new to STARS. We've been monitoring similar situations, like was earlier identified, and those kind of solutions for many, many years. We have a team of highly trained emergency communications specialists available 24 days a week, or 24 hours a day, 7 days a week. We have partnered, as you well know, 35 years in, many, many years, with our partners in EMS, our partners in government, and indeed with Aware 360. And we are extraordinarily pleased to be standing shoulder to shoulder with those partners today. We feel very, very fortunate to be working in such great company. But it takes a village, as we all know, to save a single life, and I think that this is a great example of that. And so we are pleased to be part of a solution for our community and to be part of the support for people struggling with addiction. Thank you very much.
Good morning. Thank you, Minister Luan, for inviting me here today to show my support for the Alberta government's investment in the digital overdose response system. It is a pleasure to stand with these leaders in the community who have contributed to the development of this program. I'm Chris. I'm an Albertan in my 5th year of long-term recovery after spending many years in addiction. Drugs were a part of my life from birth. I chose to use fentanyl and meth, often using at home. Both my parents were also in active addiction. These drugs took me to the streets. I was homeless for 2.5 years. I lost all hope, and I stopped seeing the good in the world. I stopped seeing the good in myself. As my drug use progressed, I found myself using at home more and more. I didn't want people to know how bad it was for me. I overdosed several times. At those times, I was lucky enough not to be alone and emergency services saved my life. I'm excited to be here today, both because I am in recovery, but also because I believe in this system. It might help others find recovery as well. I can't help but think about how many of my friends who have used at home, often alone, and didn't make it. If this professionally monitored system was available, they might be able to be alive today and be living a good life in recovery, surrounded by friends and family. I've come to love my life in long-term recovery. I work as an outreach counselor for a treatment center, helping others like myself find long-term recovery. I am now able to live a life I never had a chance of living. Thank you again, Minister Luan, Premier Kenney, and the Alberta government for investing in this system and for your commitment to transforming the addiction and mental health care system in Alberta and building the Alberta model. It is exciting to see more and more services come available for people struggling with addiction. These are important investments to make and mean more to our community than you know. Thank you.
Thank you, everyone. We will now take questions from the media. We will have time for one question and one follow-up. Operator, can you please put through the first question?
Michelle Bellefontaine, CBC. This is a question for the minister. Minister, you had an in-house phone service that was developed in-house. It was ready to go until it was canceled at the last minute last June. So what is different about this app, and why are you going ahead with something like this instead of the program that was developed in-house by AHS?
Great question. Thank you for that. As you can appreciate, in the fighting for addiction, it's a complex world. There's no one single solution, silver bullet can solve all the problems. I thank for the previous effort for that research led by a group of experts and physicians, academians, for that tryout. I believe at the time when we were rolling the provincial new continuum care model that focused on recovery, I'd advised from the provincial advisory council that we sent folks there, established a working group to work with this other project to say if there's ways we can align that to this new vision and focus. Unfortunately, at the conclusion of their own, they decided not to move forward. As a result, this one came to be born. So I like to see this as an evolution, that we continue our effort, because the intention is how can we create a virtual way to reach out to those who use drugs alone at home and bring them into the system so that we can help them getting onto their recovery journey. As you can hear, the program talking today has three key elements I believe has really elevated the standard. One is have the professional support, EMS and STARS, ambulance, guarantee the safety. The second part is it's a proven technology that have been used over decades in Alberta for working alone safety applications. And thirdly, you heard about the support system also connecting to recovery services. So by the three features here, I believe it is a continuous effort that elevate the standard and elevate the practice. I'm very proud of the work we're accomplishing today. Thank you.
As a follow-up, though, wasn't that the Alberta Health service that was going to be done over the phone? That seems to would have done the same thing. So I don't really understand why that project was canceled and then you're going ahead with this instead. What is the difference between what you're launching today and what you canceled back in June?
Let me correct you on that. I haven't canceled anything. Like I mentioned earlier, a team of advisors worked together. At their own conclusion, they decided not to proceed. I believe they returned that research grant back to the funder as that result. But that work didn't stop because a couple of people who worked on that one joined this current group, continued on the work, and developed the product today. So my take is, I like to borrow Andrew's early comment. It takes a village to raise a kid. It takes all of us to work together to solve the challenges ahead of us. So I give credit to the collaborative work that we continued on. I want to thank the work that the previous group has done, definitely contributed to the development. And I think the vision, the idea to create something virtually can reach out to those who are stuck in addiction and have a way to connecting them for our system to support them is a great idea.
Thank you. Operator, can you please put through the next question?
Alana Smith, Post Media.
Hi there. My question is for Minister Luan. This mobile application is only being tested in Calgary, but obviously overdose fatalities are plaguing cities across Alberta right now. I'm wondering how long the testing process will be and how fast it can be extended to other cities. And will the province adopt and support the National Overdose Response Service in the meantime?
Thank you, Alana. And I'm with you. I want the program to be available provincial-wide tomorrow, put it this way. But I have to respect, we want to put the safety first. We want to make sure all the coordination teams works well. And I think our professionals already alluded to some of those pieces that they're working as we speak. My hope is, giving them ample of time to have a safe, robust, innovative program available to Albertans at their earliest time. I know we've been tugging along the timeline, whether it will take several months or a few weeks. But let me tell you, I want to support them to be available as soon as possible. If tomorrow can be, wonderful. But I believe there takes some detailed work and time to get all those pieces worked out. So that's my hope here. And I'm going to defer to our technical experts to talk about their detailed rollout plan.
Okay, yeah, sure. Steve, if you wanted to address that question.
Sorry. Thanks.
As far as the timing goes, we expect to roll the pilot out in the next few weeks. We are getting a lot of input from police, EMS, and other folks. We're taking a proven platform for a lone worker and at-risk worker and moving it into a new application. And so that feedback will be really important. It will make the DOORS solution effective. But we do need feedback from frontline workers, from families, from police, to make it effective. And as the minister said, the previous group is participating in helping us bring that to light and make it practical. And so we'll work with them over the coming weeks to get ready to roll out in the summer. Thank you.
Okay, folks, that's all the time we have for today. Thank you so much for joining us.